Hello, my name is Mary O'Kane. I'm a consultant dietitian specialising in adult obesity at Leeds Teaching Hospitals NHS Trust. I work with patients who suffer with severe and complex obesity. Consequently, weight loss surgery is a treatment option for these patients as it helps them to lose weight but also helps with health problems such as diabetes and sleep apnea. The weight loss surgery also impacts on the dietary and nutritional intake of what people can eat and also affects the absorption of nutrients. Consequently, it is really important that people have access to long-term follow-up. In the NHS, weight loss surgery centres tend to only be commissioned to provide two years follow-up for patients undergoing weight loss surgery. After this, the care is returned to the GP and to primary care. Unfortunately, many GPs and primary care staff have little knowledge about weight loss surgery and what it involves. Therefore, this can leave patients feeling vulnerable. I was a member of the NHS England Clinical Reference Group for obesity, and I was asked to lead a subgroup looking at this piece of work, and the aim was to develop guidelines for the long-term care of patients undergoing bariatric surgery. I invited different healthcare professionals who are very experienced in weight loss surgery onto the group. The group also included 2 GPs and very importantly included 4 patient representatives. Between us, we researched literature and we came up with evidence-based guidelines. These guidelines were peer-reviewed and then published in Clinical Obesity in June 2016. They're also presented in Sweden at a conference, and there's several members of the group have provided training sessions around the country publicising this work. In August, the International Federation for Surgery of Obesity and Metabolic Diseases will be holding its annual conference. We have organised a postgraduate study day, and it's aimed at primary care and healthcare professionals who may come across patients who have weight loss surgery, and the aim will be to improve their knowledge and understanding so that they can better treat patients. I was stunned when I learned that the entry had won the Elizabeth Washington Award. I was extremely delighted and couldn't wait to tell other members of the guidelines group. Winning the BDA award is fantastic recognition of the work that the team and I have done. It will also give us the opportunity to further publicise this work. I also hope that it gives other dietitians the confidence to recognise that they can be involved in national work and also have a great contribution to make. Research is extremely important for evidence-based practice. We should always be trying to give the best quality care that we can to patients. In our own guidelines group, we did research the evidence and we looked at the quality of it and the strength of recommendations that we made. Some of the recommendations are extremely robust in the evidence base, whereas others it's less so, and it's based on what we viewed as a subgroup as being the best practice for patients. As more research is done, the recommendations may change. However, what we must always be doing is striving to give the best quality care to patients to improve physical and mental well-being and also, very importantly, quality of life.